Dear friends, when Patrice and Anna approached me to have a little word on the topic of today's webinar, including the inclusion of people with disabilities, I felt very honored, enthusiastic, and by the same time I was wondering, what did I do myself to include further and better people with disabilities in the projects I have run in MSF? Patrice and his teams inform us about the different barriers that exist in our operations, in our attitude, in the environment we build, how we organize, in the space, in the communication that we have with people, or simply in our institutional thinking, in how we work, in how we handle. And they inform us that with very little means, with very acceptable means, we can make a big difference. MSF is by nature, by essence, medical and humanitarian. Yet, we fall too much in the trap of looking to patients without looking at the human behind the patients. We look and we work with colleagues, but who are our colleagues, in fact? We forget too often that some of our colleagues, some of our patients, may face invisible barriers to access the services or the jobs we offer. Yet, in our operational prospects 2020-2023, we affirm a strategic orientation, several priorities that should guide us in thinking naturally about including people with disabilities. We state in that document that we will focus on vulnerability and neglect. We want to keep the patient at the center of our attention, develop a bottom-up approach. We want to develop a continuum of care between communities, health centers, hospitals. We want to get the right staff at the right place and the right role. We want to act responsible and accountable. These are all dimensions, indeed, where we have an opportunity to reflect about today's webinar. In our medical strategies, 2020-2023, we want to deliver high-impact medical interventions to meet the health needs of the populations, to meet the demands of the populations we intend to serve. We focus on the most vulnerables. We focus on the biggest needs and impact. We want to provide quality treatment to prevent the creation of disabilities. And even in one of the documents also it's mentioned that we want to develop activities where childcare with disabilities can be tackled. When looking at the video myself and reading through some documents that were produced by Patrice and his team, it remembers me as well of the earlier days when, more than 20 years ago, we started putting people with HIV on antiretroviral treatments. At that time, stigma, shame, ignorance was preventing patients to come to the health services and was preventing our health staff to provide the life-saving treatments. And now, 20 years later, we've engaged in community development, community programs. We've developed community dynamics where people participate, are included, and are themselves agents of change for bringing the treatment in their communities. What has helped us to get out of the obstacle was to step out of our professional way of thinking from an ivory tower, to sit down and think together with the patients, to think about their reality and changing our offer to their reality rather than their reality to our offer. Of course, we have many competing priorities. There are so many requests, yet Patrice and his team want to make us attentive that there are simple steps that we can do that will just make this difference, like we did 20 years ago when we started providing treatment to patients with HIV that were stigmatized, neglected, forgotten, and that we thought it was impossible to do something. And agreed The difference that will be requested might not appear in our guidelines. It's not an operational procedure, it's not an SOP. It doesn't appear in our job descriptions. It just asks us to have an open heart and to look around, to sit down with partners, to think comprehensively about access and offer. And these are not by coincidence the conditions not only to address the topics of today's webinar, but also to make just the difference in our daily life, in our medical, humanitarian work of every day. I wish you plenty of success and endeavors, plenty of good ideas, and enjoy the webinar. Thank you very much.